Dr. Tushar Patel, welcome to ITV Gold. I hope you're doing well today.
Thank you so much, Aditi, as always, for getting me back on ITV Gold.
Of course, we have to have you because, again, there's so much going on and we have lots of questions. So, my first question to you has to be, Doctor, today some stats are coming in where we are looking at more than 40 million COVID 19 cases total in the country. We have surpassed 40 million, which means 1 in every 8 people has had or has COVID. How troublesome is this statistics, and how worried should we be right now?
Very troublesome. In fact, one statistics I would like to give is 1,500 Americans are dying every day for past few weeks. Specifically, some states, Oregon, Idaho, Texas, Arkansas, Mississippi, Louisiana, Georgia, and Florida. These 8 states consist of 75 million people, and only 1,400 ICU beds are available in those states. So we can imagine what's going on in the country right now.
Right, and let's talk about these states a little bit. I believe some are running out of ICU beds, some have already run out of ventilators. I believe you have colleagues in these states. Can you tell us what is happening there right now? What kind of news are you getting, and what is the true condition of the medical community?
So the ICU beds definitely are a huge concern right now. PPEs, oxygen supplies, ventilators, all those are very scarce in those states, because when there are no ICU beds available, you cannot treat not only the COVID patients, but other patients who are suffering from cardiovascular disease or other motor vehicle accident or many other medical emergencies which requires ICU beds. And if you don't have the ICU beds available, then it's going to be impact to all cases coming to the hospitals.
What do you think these governments in these states need to do right now in order to, curb this spread right now?
So the governor needs to understand that the pandemic is still on.
Right.
They need to provide the leadership to save their citizens from getting into the ICUs and getting have the mortality cases. The government needs to communicate truthfully with their citizens, irrespective of their political or personal views, and ensure that their citizens are safe. So in that case, they need to ensure that all the citizens in their states are fully vaccinated. That we have the tool available right now to get the vaccination done. And if we don't use that tool, I think we will be in huge trouble coming in the winter months.
And when you are talking about trouble, doctor, let's talk about the states that are vaccinated or where a higher population is vaccinated, like New York, New Jersey, Connecticut. How long do we have before we start getting affected as bad as some of these other states?
As soon as the fall and the winter month hits in, I think we will see a different picture if we don't have the good control overall in this country with the vaccination rate. As you know, more than 150,000 daily cases happening in the US, 4 million cases in last 4 weeks. So you can imagine what's going on right now at almost end of the summer. And when the fall and the winter month kicks in, I think we will see a different kind of picture in this country.
And hospitalization rates amongst children and younger adults, adults under the age of 50, again, we're seeing high levels of those cases. What is the biggest, issue regarding that? And when you're looking at children, are these cases rising because the schools have opened?
So there are two things. Not all kids are eligible to get the vaccine. So
Right.
kids under 12 is a huge concern, right? And the schools are opening. Some states already had the school open in middle of August. So these are the cases we are seeing right now. The huge surge in the number of COVID cases in the young individuals, and that's because they are not fully protected yet. And the second is they're going back to the classroom setting.
Right. In terms of this vaccination, doctor, what can you tell us about when we can expect vaccines for these younger children? I believe they are saying sometime in the fall.
Sometime I would say by end of this month. I would say if my fingers are crossed right now, if my guess is by end of this month, early October, we will have the vaccination for kids between 5 and 12. Another few months, probably January, February time frame, kids under 5 years of age.
And how important is for us to get these individuals vaccinated, doctor? Because I know a lot of parents might be hesitant to get their very young children vaccinated.
So right now only 62% of Americans are eligible. So we need to increase that number to at least 75, 80%. So until we reach that number, it's going to be a trouble. My message to the parents is get them vaccinated as quickly as possible. And protect the entire community, your family and friends, because if you don't do that, young kids will end up in the ICU and they may get some complications from this COVID-19 virus.
What do you have to say to people that are protesting against having mask mandates, especially in schools or in indoor settings? What do you like? How do you respond to that?
So we are at the end, almost at the end of this pandemic. However, with this Delta variant, we have the new concern. We need to follow the guidelines. We need to follow the science. We need to follow the epidemiology. We need to follow our experts who have been doing this for years and years. CDC and FDA and all other federal agencies, NIH. We have to follow them because we don't have any other answers but get the vaccination, get fully protected. Most important thing this time is to get the unvaccinated their first dose of vaccine. If we do that, I think we will be in a better shape.
But do you think we will do that? Do you think we will reach a point where we have enough people vaccinated? What is your, medical feeling in this sense?
We need to reach there very quick, and we are almost end of that window when we had that summer month, June, July, August. Now we are in September, and within few weeks we'll start the fall season. The influenza will kick in, and all those respiratory viruses start coming in together with this COVID-19 virus, and it's going to be a huge deal. And I hope that happens. We need to reach about 10% more people getting their first dose of vaccine. Let's pray. My sincere request to all who are listening to this, get your vaccination if you haven't received your first dose.
Yes, of course. Vaccines.gov is the website. We're always promoting that. Doctor, a lot of big companies are thinking about having their employees come back to work in the month of September, basically when the fall starts. What kind of protocol do you think they should maintain? And is it wise right now for these companies to bring back their employees?
So they should be using the common sense approach. And if they have to bring their employees back, I would recommend two different things. Number one, ask their employees to get the proof of vaccination. That's number one. And stagger their employee, not bring all the employees together, all their staff together in one big room or in the office setup where they can mingle together. They need to stagger. Maybe one group of individuals can come Monday, Wednesday, Friday. The other one can come on Tuesday and Thursday. Something like that setup will definitely help them reduce the spread in the office setup as well as in the community spread.
Doctor, let's talk a little bit about individuals that have had the vaccine but they're getting COVID. Is it because Delta variant is just way too strong, or is it because their immunity is waning off and that's why we need the booster shot? How are you looking at this?
So the Delta variant is definitely one of the infectious virus right now we have in this world. Right. However, the breakthrough infection happens only 1%. So only 1% of the people are in the hospital or in the ICU setup are vaccinated. So 99% of the hospitalization or people who are in the hospital have no protection at all. So that tells you that the vaccination works. Number two, of course, the vaccination wanes after a few months, 6-8 months. and that is the recommendation. That is the recommendation from CDC to get the booster shot or the third vaccine or the third dose. It may not call the booster shot. It probably wise to say everyone will require 3 shots if you receive the mRNA vaccine with Pfizer and Moderna. So breakthrough infections are very rare. Only 1% are in the hospital. But the third vaccination, we have to follow the CDC recommendation right now. It is okay for the healthy individuals to wait and see what CDC and FDA recommends before going and getting a booster shot. Right now, the recommendation is to get those people who are aged, 65 and above, who has immunocompromised status. All those individuals should protect themselves first, and then the CDC will recommend after September 20th that who should get the vaccination in the line in the next recommended dose.
But doctor, so you know, the World Health Organization said that right now people do not need a third dose. Rather than using those doses for the third shot, they should be sent elsewhere where they don't have enough vaccines. How do you then look at that? And also, when will we actually know when our booster shot is due?
So the recommendation right now is 8 months after your second dose to get the third dose. However, the CDC did not recommend that yet. I think that recommendation will come around September 2nd or 3rd week, maybe by next week, by September 20th. My personal feeling is we will need to get the third dose because of this Delta variant is very vicious and is very infectious. All people in the USA will need to get the third dose at some point. I'm not sure when that some point will be, but my recommendation probably within next few months. As far as giving the vaccination to other countries, I think much more planning needs to be done because there are 1.8 billion people in this country requires the vaccine, and it's only not even half of the vaccinations are available throughout the world. So I'm not sure how we're going to reach out to the entire world and vaccinated them and get the herd immunity.
What do you have to say about the handling of this pandemic by the Biden administration? Do you think they're doing the best that they can?
So far, they have been doing it okay. However, there are so many challenges with the Biden administration as well because of this vaccination hesitancy. Not enough people are reached to get the vaccination. So I think we need to get more convincing information coming from the Biden administration, including CDC and FDA. And I think we need a major campaign for the vaccination to reach out at least 10% more of the people in this country in order for us to have this pandemic called off.
Let's quickly talk about India, doctor. We are again hearing about the third wave. They're saying it won't be as deadly as the second wave. How are you looking at it? And do you think, again, the reporting, do you think enough cases are being reported? Are we seeing the right figures come out of India?
So the one thing I can tell you about India, that 2/3 of the population in India already have COVID antibodies through natural infection. So that's about 30-35% people. However, the bad news is only 7.6%, 10 crore people are fully vaccinated in India, which can probably, if we have the third wave, we will see close to 500,000 cases every single day there. Let's hope that's not the case. I don't trust the numbers coming from India because the CDC is only telling that only less than 10% of the people got the vaccination in India, versus Indian media is telling that about 50% of people are vaccinated. So it's a very conflicting information. It's not encouraging information coming from India, and I hope they don't get the third wave. If they get the third wave coming in winter months, it's going to be a huge challenge for the government to manage those cases.
But they have opened everything in India. It's no
Everything is open
longer,
in India. That
yes.
is concerning. That is very concerning. And I think the government needs to communicate with their citizens to ensure that the pandemic is still on. And even though you don't have the cases right now, it could lead to a huge concern later on.
What's the biggest worry when you look at India?
The biggest worry I look at India is the vaccination rate is so low, and although the natural infection immunity is there about 30%, they still need to reach about 70%. So I would say that is the biggest concern. They need to bump up the vaccination rates in India, especially in rural areas
Right.
where they don't have any concept or education about the infection and how the infection and the disease are spread. So I think those are the biggest concerns in India right now, and I think government need to start working now, building the oxygen plants and oxygen facilities instead of waiting until the third wave hits in.
Schools are also being debated about doctor in India, not as intense as here with the mask and vaccine mandates, but they're being discussed. Many are saying that, you know, the poor communities, those people are not getting access to online education, so it's important for them to come back into in-person schools. How should they be bringing those schools back? What should be the protocol?
I think they should be bringing the kids with the social distancing guidelines. That's number one. Number two, with the mask and hand hygiene practices. I think those are the three basic things they need to do. Even if they don't have resources, government should provide the resources for those school systems in India, especially in rural India, for them to get succeed with this pandemic.
Right. My last question to you, Doctor, I'd like for you to let us know about your prediction for the next couple of weeks for the United States and also for India as well.
For for the US, I can tell you that most important thing right now at this time is to get the unvaccinated get their first dose of vaccine. It is okay for all of us who are healthy, who are fully vaccinated with two doses, wait for the third dose until the CDC and FDA recommends that. Use common sense approach. If you are going in the indoor gathering, wear the mask irrespective of you are vaccinated or not, because we don't know who are vaccinated and who are not. So I think those are the common sense approach. We need to have this in the US. We are in much better shape than in India. For India, I would say education, education, education. Get as many people as they can to get at least one dose of vaccination. Get at least half of the population get two doses of vaccination within next few months, and I think I will see a good outcome in India. But at this time, my prediction is if they don't have the fully vaccinated people, about 30% more of people versus 10% in the US, I think they will see a third wave in India as well.
Well, we'll be following up with that for sure with you. Thank you so much today for your time on ITV Gold.
Thank you so much, Aditi, as always.
Of course.